Xenotransplantation is the process of transfer of cells, tissue, or organs from one species to another. Think about if someone had a heart that wasn't working, doctors are able to use a pig heart that has been genetically altered and use this heart as a temporary replacement for the patient.
Is doing well after receiving an experimental transplant of a pig kidney.
I just had an ultrasound. Dr. Yella said my kidney's doing absolutely wonderfully.
The 54-year-old New Hampshire man got his new organ a few months ago.
Our third xeno recipient got transplanted in June, and he's now completing 3 months after the kidney transplant.
This as the FDA approved the company that provides the genetically edited pig kidneys can begin a significant study of what's called xenotransplants. That's a transplant from one species to another.
As perfect as this sounds, unfortunately, this process has its disadvantages. The infection and rejection risks are prominent, which means that the patient will likely have a long life of monitoring and checkups. Xenotransplantation also has an ethical impact on animal rights and the psychological impact of experiencing transplant. This has an obvious effect on human biology through immune and physiological responses to the new cells and/or tissue. Xenotransplantation is a controversial treatment process due to its high risk and the ethical discussion around it. Overview of the process with focus on animal to human xenotransplantation. The process is long and extensive to ensure safety and success. To begin, the donor animals are bred in a pathogen-free environment. This process is considered unethical because of the exploitation of animals as a device for healthy organs. Their genomes are altered to remove genetic material that would be rejected by the human body, or adding genes to match more to the human genome. By genetically modifying these animals, they undergo many invasive procedures such as blood tests and biopsies, which can cause discomfort and suffering. The animals are screened and tested on to ensure no pathogens or viruses present. The needed organ from the animal is removed in a sterile environment. As for the human, they are tested for compatibility with the animal genes. They may have the failing organ removed prior to decreased rejection rate. Then the animal organ is transplanted into the human body, immunosuppressive therapy following surgery to prevent rejection. The patient would undergo close monitoring to look for rejection or zoonotic diseases, followed by more lab tests, clinical analysis, biopsies to ensure their safety. In many cases, the organ recipient suffered psychological trauma revolving around the idea of an animal organ in their human body. This is an ethical consideration that all patients must encounter before, during, and after xenotransplantation. Risks involved. Unfortunately, through this process, there are many risks regarding biological and sociological factors. Infections, one of the main issues in the infection risk. Because it is animal to human, there is a chance that the animal's microorganisms form unknown pathogens in the human body. Viruses, bacterial, fungal, protozoan, and worm infections are all possible even with precautions taken. This high risk of infection is because the patient is given immunosuppressive drugs, which allows the body to accept the new organs. However, this makes the immune system vulnerable because it won't know what tissues to attack and what to accept. Even with a system of breeding donor animals that is pathogen-free, latent or novel infections may be missed by screening tests. This method is highly unethical as it corrupts involuntary animals and destroys their lifestyle and well-being. With these factors of a suppressed immune system and infections that can bypass detection, infections are a major risk when performing xenotransplantation. Rejection. Moving on rejection, this is when the body attacks the new organ and tissue because it thinks it is a foreign invader. In xenotransplantation, there are three main types of rejection: hyperacute, acute humoral, or cellular rejection. Hyperacute rejection is within hours of the transplant and occurs when pre-existing antibodies attack the cells in the replacement organ. This is rapid and leads to organ failure. There is also acute humoral rejection, which is triggered by emerging antibodies post-transplant after a few days. This causes the tissue of the implanted organ, also known as the graft, to damage and eventually fail. Lastly, there is cellular rejection when the body's defensive cells, such as macrophages, T cells, and lymphocytes, damage the graft over a long period of time, such as weeks or months. This biological rejection can also go hand in hand with the psychological rejection. The patient may have trouble accepting the concept of an animal organ in their body, which can be reflected with their body's rejection of the organ. Therefore, overall, rejection is tricky to avoid because methods to avoid rejection can increase risk of infection. Quality of life. With these biological challenges, there is also the psychological quality of life.
Patients will have to adhere to strict medical regimens like taking multiple immunosuppressive drugs and having regular doctor visits, which include sampling or biopsies of the transplanted heart tissue to check for rejection, which can be an anxiety-inducing process. The transplantation process is very energy taxing, and it can take several months for a person to gain their
The patient
energy
will most
back.
likely have to spend the rest of their life being monitored and have regular checkups to look out for this infection and rejection. In the case where they do inhibit an infection, the quality of life will be depleted with treatments which could result in another transplant or death. Similarly, with rejection, if the body rejects the transplanted organ, it is most likely going to lead to another set of surgeries for a new transplant or, unfortunately, death. These risks determine the value of xenotransplantation for a patient. The biological risk of rejection or infection are common and will deplete the patient's quality of life. With these risks, 52% of nursing students support xenotransplantation without regard to the moral implications. This, tied into the ethical considerations, has a controversial process that must be taken into account. Ethical considerations with regards to the safety and success of the method used for xenotransplantation, we must also take into account the ethical damages that occur during the process. Animal rights. A major concern regarding the ethics of this process is animal rights. Animals, much like humans, have feelings of pain, stress, and social bonding. This is exploited by using them as organ sources for human benefit. The repetitive invasive surgeries cause infections, stress, and premature death for these genetic engineer animals. This process also calls for periods of isolation, which can cause an animal to have difficulty socializing and returning to normal animal behaviors. Xenotransplantation's method of industrial harvesting animals as organ farms is ethically wrong as it enforces practices of animal harm and endangerment. Overall, society is more comfortable with the idea of vast animal slaughter than the concept of animal abuse due to the already preceding issue of over-farming livestock. To improve the rights for animals, transparency with the public would ensure authenticity and truth regarding the process, as well as minimizing the amount of invasive surgeries and tests to lessen the stress and discomfort for the animal donors. Psychological impact is for the human side of the ethical considerations. It is important to address the emotional difficulty of accepting an organ from an entirely different species. This distress is commonly caused by social belief and attitude towards xenotransplantation. Some believe that patients acquired animal traits after the surgery. This can cause depression and anxiety for patients going through xenotransplantations. Research shows that there is a rate of 0 to 46.9% and 0 to 66.7% for depression and anxiety, respectively, post-xenotransplant. However, we can lessen this impact with proper education and therapy to ensure all prior fears and hesitations are put to rest. Xenotransplantation is the process of transplanting cells, tissues, and/or organs from one species to another. With main focus on animal-to-human transmission, we have covered the process, risk involved, and ethical consideration. The method includes farming animals and genetically modifying their genome to fit the needs of the human body. These cells are then transplanted into the human to improve bodily function. This comes with risks of infection, rejection, and low quality of life, as well as the ethical considerations regarding animal rights and the psychological impact. Overall, xenotransplantation is a new technology used to prolong life and improve organ availability. However, this comes with a multitude of risks and moral implications that can be further developed and must be taken into account.